Just going to share my screen here and we can get started. Hey, welcome everyone. My name is Meg Yanaba. I'm an HCBS Benefits Supervisor here at HCPF. And today we are having our first meeting regarding the Host Home Oversight project. So to go over our mission here at the department, our mission is to improve the healthcare equity, access, and outcomes for the people that we serve while saving Coloradans money on healthcare and driving value for Colorado. So for our agenda today, I'll do some introductions and then introduce House Bill 231197 and kind of the preliminary deliverables that we are expecting through this process. We'll go over the purpose of the bill, the outline for this project, kind of talk about next steps, and then there will be a survey that we will give you at the end of this presentation for your feedback, and then we'll allow for any questions, comments, or concerns. So as I said, my name is Meg Yanaba. I am the HCBS Benefits Supervisor overseeing this project. My supervisor, Cassandra Keller, who is the HCBS Benefits Section Manager, is here with us today, as well as Victoria Rogers and Devin Rathman. They are both benefits specialists with the department that will be assisting with this project. So, House Bill 231197, it was passed back in February. This bill dictates the process for engaging stakeholders and completing research and gap analysis of current Colorado policies when it comes to host home oversight, as well as what practices are being done throughout the nation. The bill is to ensure that members who require 24-hour care 7 days a week are provided and entitled to a safe environment where agreed upon services and supports are provided. It is the responsibility of the Department of Healthcare Policy and Financing to develop a system and a process to ensure that the members who receive such services address concerns and identify solutions as it relates to the oversight of host home providers. So House Bill 231197, as I said, has passed, which means we are in the beginning stages of starting this project. This project was dictated to kick off starting September 1st. So we're a little bit ahead of schedule, but we wanted to get this out to you as soon as possible. So we're starting the stakeholder process now. We are also seeking to gain essential feedback from you regarding your concerns, as well as what your goals would be for this project and what would you like to see accomplished by this project. This project will also allow for the development of a system for reporting and monitoring the actions taken by host home providers that conflict with member rights and person-centered services. So the deliverables that we are expecting from our contracted vendor is an environmental scan. Part of this environmental scan is seeing what is current in the state of Colorado as well as across the nation. What are the best practices? We'll also be looking at a review of the host home trends, complaints, and incidents data. Develop a grievance procedure resource packet for members, how to report a grievance and who to go to. And then we also want to facilitate small groups of stakeholders to help with idea generation, rule language, as well as just overall brainstorming. How can we make this happen? So for the timeline, as I said, today is our introductory meeting, our first stakeholder meeting. September 7th, we will be closing the survey that you will all get at the end of this presentation. It's a very quick survey, just getting kind of your feedback of what you're seeing and what you hope to get out of this project. And then future stakeholder meetings, as well as small group sessions, will be determined in the future. We're not quite sure of the frequency just yet, but we are open to suggestions of how often you would like to meet for small groups. Part of the survey, you will also be asked if you're interested in participating in a small group. So please feel free to add your name to that list if you'd like to be more involved with this project. So currently, the existing oversight mechanisms that are being used is the Colorado Bureau of Investigation, which this is the background check for host home providers. So detailed information about arrest records provided by Colorado law enforcement agencies. Typically, service provider agencies will also incorporate in here a driving background check as well. And then there is the Colorado Adult Protective Services, or the CAPS check. This determines whether an individual has been substantiated of physical abuse, sexual abuse, caretaker neglect, exploitation, or a harmful act. What we are hoping to cover, and the purpose of this project, is to really examine what are the things that are happening within host homes that may not be covered by a typical background check or a CAPS check, that we still consider unethical or non-person-centered behavior. So this could be failure to comply with PASA or case management agency standards of practice, policies and procedures, duties and responsibilities, direct violations of person-centeredness. This could be enforcing rights modifications or rules that are not approved upon, unusual punishments or consequences, neglecting to provide person-centered approaches towards care under the final settings rule, things like that. But also could go into falsifying identification and records, not providing records, failure to report new charges, motor vehicle accidents, violations, things like that, where it's not covered again under a background check or a CAPS check, but still behavior that we want to be able to track and monitor, where a host home could be putting an individual at risk. So our vision for this project is to create a system for the non-compliant providers to be held accountable. That would ensure that our members are provided with professional, qualified, and trained staff to ensure the safety and well-being of the members within the host home residential setting. Furthermore, this project will allow for the opportunity in discussing the needs of further oversight in other IRS settings. Our goal is to create a system where we can not only track and monitor this, but that also agencies, applicable agencies, would be able to use this as a resource prior to hiring an individual or contracting with them. We want to do this to prevent the bad actors or unethical behavior from jumping from agency to agency without consequence. The success of this project will be contingent upon your feedback. What do you see? What do you want to see happen? And what kind of concerns do you have? We want to hear from you about these things and your feedback regarding the goals, ideal state for the host home providers and oversight, and the accomplishments of the projects will be essential to developing the provider list in the future. So the next steps, as I said, we have a survey for you that will be open. I believe it's open now. I will have the link in there. And then that will be open until September 7th. So that gives you a couple of weeks to get that done. We will take in all feedback and take it into consideration on how we move forward. And we will continue this process with the stakeholder engagement to make sure that your voices are being heard and that we're really incorporating what you see and how you think this should be managed. Then we'll talk about some next steps. Once we get that information, we'll be working with our contracted vendor to get the ball rolling on stakeholder engagement meetings, future meetings, as well as identifying for those who are interested in small groups, sometimes that may be available to meet with our vendor to do those small focus groups. Okay, now I do have the link here. I'm going to copy this link and put it into the chat here. While I'm doing this, I'd like for Victoria or Cassie to jump in. Victoria, I know you've been monitoring the chat. Cassie, is there anything that you think should be additional that I have maybe missed during this presentation?
No, I think, our plan here is to open the floor to you. We are seeing some good ideas in the chat. So we want to know what do you think is important that we consider in here? Not only is what are your goals and what would ideal oversight of host homes look like, but what are considerations that we need to have? For example, we've heard some ideas like host homes need to be licensed like foster care, and maybe the consideration for that needs to be like, that is an extremely time consuming and costly process, and that would be over restrictive, or the consideration needs to be that we be careful not to remove all flexibilities for PASAs, and therefore folks aren't able to really utilize the host home model like it's supposed to. So what do we need to know as we are moving in to start this process? So I think, Amy, if you want to come off, I actually, don't know what I think Colorado's P&A is. I'm not sure what that is, but I think we'd love to kind of talk to Disability Law Colorado, see, but at this point, they don't have a formal role, but certainly their input would be helpful, I'm sure.
Hi, I can unmute. This is Amy. So they're the federally mandated protection and advocacy organization, and they have the unique ability to do SNAP inspections basically in any kind of institutionalized setting. And I'm minimizing what they do, but they were behind the lawsuit for the Colorado, for the Mental Health Institute in Pueblo, which I know is not necessarily what we're talking about here. But they're charged with going in to seeing how CCBs or certain kinds of adult care facilities do their job and take legal action as necessary. So that's part of their mandate, which is why it might be worth talking to them, because they collect a lot of this information and they also talk to a lot of consumers. That in addition to ARC and all the other wonderful people on this call. I'm happy to share their contact information with you if that would be helpful.
Thank you, Amy. That would be fantastic. I know that in the process of discussing what we here at the department are interested in seeing from this project, we have talked about collaboration with multiple different parties, including CDPHE, APS, and so I'd love to get someone from Disability Law Colorado involved as well. I think that they would be a wonderful asset. Okay. And then Julie, so your comment about what about plain failure to do their job, such as not providing hygiene support, not taking them to do anything meaningful, not coordinating medical care. Absolutely. These are the types of things that we are talking about, where potentially, unless under the hygiene support, unless there's a report made regarding neglect, they could still be engaging in this behavior. It just may not be reported. So how do we go about making sure that those things aren't happening right under our noses? And what do we do about them? And let's see, something to consider is consequences for agencies who hire providers, even if someone is on the non-compliant list. Yes, we have also thought about that. And what would be our policies and procedures regarding that? That if this person is listed as someone on the non-compliant list and you go forward with hiring them, what are the sanctions against the agencies that are knowingly kind of turning a blind eye to these? So yes, that is something that we have also encompassed in this project. Okay, I see from Horizons. Oh, I apologize. I see that you guys are not having luck with this link. I'm going to work on that. Cassie or Victoria, would you mind going through any other comments that were brought up that are not related to the link?
Yeah, I think Christina from the ARC brings up a great point. We really want to hear feedback from host home providers. We want to hear from all areas, not just from advocates or members. We want to hear from providers, disability law, host home providers themselves, direct care professionals. So we hope to hear from all of you and have it run the gamut. And then Robin, I think this is a good point of most important would be a surprise visit so that someone has an eye on the person to make sure they're being treated with respect and are not being neglected or abused. The visits would need to be unannounced and fairly, I guess, impromptu. Another suggestion is accountability enforcement, including restrictions placed on host home providers that violates people's rights, tracking those providers. Yeah, absolutely. I think trying not to have folks hop from place to place. I don't really want to spend the rest of the meeting reading off these chats. If anyone wants to come off mute and share their thoughts, share what they're hoping to see out of this, that would be great, rather than me or Meg just reading the chats. But we are obviously keeping a log of all of the comments that we're getting out of here so that we can take that back. See, there's a couple people off mute. I'm not sure if you're trying to speak or. Dolores, I will go to this one. Provide a daily rate reimbursement when an individual and services is hospitalized. So basically a kind of a hold, a payment that is a hold. And
yes, this is Dolores. I can answer that. Sorry.
Yeah.
So yeah, there have been 2 incidences where, as we know, or maybe some of us are familiar with host home clients passing away, and they passed away from preventable, treatable ailments. And people do what they're incentivized to do. And when you have a host home provider who, no matter whether the client is home or not home, the lights have to stay on, you know, the rent has to be paid, etc. The show must go on. And also, many people in services, and I would say the vast majority of people in services, still require their host provider to support them, sometimes overnight, even when they're in the hospital. And I think that the residential rate should continue up to day 29 when Medicare stops and Medicaid would take over. And this would remove any hesitation or financial barrier from host home providers. And also, when it comes down to it, agencies don't want to see people hospitalized because you can't bill for the hospitalized day. So I totally hear everybody wanting to put more restrictions and put more oversight on the host home provider, but also let's incentivize them also to be better and to give the best care and to not hesitate to take the individual to the next level of care. That would only be protective. And Medicare, as we know, is a separate funding stream than Medicaid, and definitely a separate funding stream from the waiver. So I would just put that as an amendment to the proposed bill, that the DD service plan, the DD residential service plan, pays out and continues up to the 29th day of an inpatient hospitalization stay. That would, I think, be very, very protective of our clients and very sustainable to them too, because we also see very, very often somebody gets hospitalized, or they're hospitalized frequently. It becomes completely impossible to place that host home person. It eventually, they just become persona non grata because they are hospitalized too much. And so nobody wants to provide them with residential services because there's too many missed days. So that's all. I just think that it's one thing to put the hammer down on everybody and make more rules and more oversight and more punishment or consequence. And it's quite another to come alongside and support and encourage the absolute best, excellent care. Because like I said, people do what they're incentivized to do.
But
Sure.
Dolores, to that point, if they don't qualify for Medicare, that's even worse. So if that,
It still doesn't become a waiver Medicaid funding stream until day 29.
okay,
Yeah, this is Julie Riskin. Medicaid does not allow people to get waiver services while in the hospital, which we think is a huge problem for all waivers and something we're trying to address, because the day-to-day like care that people need is not what hospitals provide. And
Right,
CMS,
and
CMS has said that states can do it. Colorado's just choosing not to, but that is a separate issue. Like this bill, it's not proposed, it's passed. That would be separate legislation, which again, we would endorse, but I don't think that's part of this legislation.
I see. Okay, then all right, I didn't realize it had already passed. I came in late to the movie. Okay.
I do want to ask the group a follow-up question that's somewhat related. Is there's I don't know where this came from, but there is a difference in rate between a host home provider and an IRSS provider that is a family caregiver, PCA, or anything else that is not a host home provider. Does anyone have historical background of why that happened? Do they see that there should still be a difference? Obviously, we don't have the funding and the appropriations just to bring host home automatically up to that other IRSS rate, but is there a reason that there is that distinction? Is there a good reason? Should there continue to be that gap? It made me think, as Dolores was speaking, that about higher rate, I just am not sure that there is good justification why they're different.
Typically with PCAs, like if you're paying for staff for that person versus a host home provider that's contracted. So let's say it's you're doing a 3 PCA, it's the agency having to pay for that staff person versus a host home provider that's contracted.
Okay.
so PCA and family caregiver are paid the same. So those two entities, but host home provider is not.
Correct.
Honestly, no, I know. I honestly don't understand why that would be, because the level of care doesn't change
Right.
from any of those three entities. PCA, family caregiver, host home. The care is the same. I think the pay should be the same. That would incentivize. On Dolores's point, that would incentivize.
Yeah.
those.
Alexandra has her hand raised.
Yeah, my understanding of the family caregiver rate is paid out of that individual rate, which is lower than a host home rate. And my understanding is that family caregivers, somebody who's related to the person and services, are paid at that lower rate because they're already part of their care is as a natural support, as being part of that person's family.
No.
Okay, so that may be, I guess, at the agency level, but host home providers do get room and board, Rebecca said, but the rate that is paid on a daily basis by the department, by HCPF, that rate is higher for PCAs and family caregivers. As a family caregiver, you may get paid at the end of the day less than, but that's probably with I lost my train of thought looking at the chat. That's what happens when you look at the chat.
No, I was just gonna say historically that's why it is higher for the PCA. It's because it's considered like you're typically staffing versus contracting. Like if you have to pay for 24-hour staff, like there was just a little higher cost to that. So it's typically staff versus contract. But I mean, I agree, like the level of care it's not really different.
Yeah, I think Julie's question is a staffing model. Is that better?
Also, the staffing model, I think people need to understand, is agency specific. Some agencies have contractors, some do not. Some have employees. So that cost is different. I mean, those people are paid differently.
Yeah, I think Jody just made a great comment there, and then I'll turn to you, Christina, is that I think historically family caregivers were more so employees and had higher costs and therefore got paid more. But I think as we're seeing now, agencies are doing contracting with everybody, and it's not just with host homes. But Christina, go ahead.
Thank you. Part of what we see is that host home providers will shop around. So when you don't have kind of that standard reimbursement rate, then that's where we see host home providers jumping from agency to agency, which of course causes so many other issues. And so maybe looking at some type of standardization for what can be reimbursed.
That's a great point, Christina, and not something that we haven't heard before. You know, should we say like you can't something, it's really hard. We don't want to do too much dictating of business practices, but is it, you know, 80% has to be passed on or whatever that percentage split would be. I see Kaylee.
Yeah, I just wanted to echo what Christina said. I think we're even seeing a trend in the last couple months where agencies are telling us that they have providers being poached by other agencies, and ultimately the client is the person that gets caught in the middle of those. And especially if there's not a guardian or someone involved, then it becomes this entire mess where the team is trying to determine, like, does this person want to change agencies, or is it the host home? Are they being influenced? I think, yeah, it just creates a mess again with the client caught in the middle. So I think some sort of standardization, like Christina mentioned, would be incredibly helpful.
Hi, this is Dolores again, and I have to say that standardizing the reimbursement changes the priorities, because my reimbursement is not as high as other agencies, but I also have 3 RNs on staff, and I specialize in really medically fragile and extremely high behaviors. And so I have to have more ancillary support in my office for HRC and all of the other pieces that brings. So a standardization I think it's a terrible thing, and every company can decide, and every individual and provider can decide, you know, who they want to go with and what their priorities are. Because I serve some people that could not possibly get the amount of support. And I have folks who've left because they're going to get 80%, they're going to get 80%. And then 1 month later, they're back because they find out, yeah, they get 80% and they get 0 support. So, I would say let's let people set their own rates and focus on just excellence and higher quality, and incentivizing people pursuing appropriate levels of care.
And I was going to say, as far as like providers jumping from agency to agency, a lot of the time it's because those agencies also haven't really talked. Like, you don't know the whole backstory of what that provider did to know that, oh, this provider isn't good. So I think if you have that communication, that would help, because you don't want to knowingly take on somebody that isn't up to the level that they need to be. So a lot of that is communication as well between agencies.
Jabroni, I just want to follow up on that. Are you saying that like the PASAs, the provider agencies, have the responsibility to speak beforehand and say, hey, this host home, you should know that this host home provider is got trouble, or what kind of communication are you saying needs to occur or should occur?
Yes, like let's say they're going to another agency. That other agency may not know what happened with that provider, right? And especially if nothing is showing up on CAP, how would you know that?
Sure. And would that, sorry to follow up again, I guess, is that if the host home provider is moving on or if that's the member is moving agencies?
So it's more the host home provider. Let's say a host home provider, they're moving from agency to agency. I'm just kind of talking in general.
Yeah.
The agency that they go to, I'm saying they may not be aware of what's going on with that particular provider. If nothing is showing up on their background, nothing is showing up on their CAPS, how would they know?
Okay.
And that's kind of the purpose of this bill, is how to capture those things that are not included on the CAPS check or the background check. And how do we monitor and allow agencies to be aware prior to hiring someone that potentially could continue to hop to avoid any kind of disciplinary action, or that is bringing along with them some bad habits.
I'd like, we have some hands up. I'd also like to ask the group, I guess, as a PASA, how reasonable is that? Do you always know where the host home provider is going? Is that something that you could see yourself doing, of calling other agencies if you know about it at least?
I've done it all the time. Oh, sorry, Jabania. Go ahead.
No, you can go ahead.
I mean, as an advocate, when I catch wind of a host home provider moving agencies, I call the agency myself and tell them the history and why this person is probably moving. And that's why I made my original comment earlier that agencies also need to have some sort of accountability if they do hire off the non-compliant list. I mean, probably 8 times out of 10, if I call an agency and say, hey, this host home is an inappropriate provider, not doing what they should, I end up finding out that that agency that I contacted myself hires them anyway.
Kathy, I'd like to turn to you. Sorry. Had your hand up a while.
All right. So this is Augustine, by the way, but I'm in the office here with Kathy. So I was just going to go back to the piece that was stated earlier with regards to agencies or PASAs actually moving these individuals without that individual knowing. Like, say, for example, we as an agency, we have had those instances where our individuals in our host home attending their program at another agency, and then those their program providers end up pulling those individuals away into their host home, into their PASA. And so that happens on a regular basis. And because there is nothing to hold these other agencies accountable, I mean, it is a practice that is just going on. They go to their program, because they have PASA, they just pull them away into their residential because they have no either guardian. And sometimes we look at it to be an exploitation. You're exploiting that person, manipulating them, and a lot of different things happening. So I don't know what the guidelines is going to be around that, but I think that would be very helpful to have something like that in place.
Deanna, you want to go ahead?
Yeah, this is Deanna from the Arc of Adams County. I was just going through the survey and wanted to answer the question where it says, in your experience, have you found concerning behavior or history that is not captured in the background check or in the CAPS check? I would say that's commonplace, simply because it's very difficult to get onto the CAPS check. And I think I put it in the chat that our particular county, the Adult Protective Services division, they only open about 33% of the cases. And the cases that I have reported personally, many of them haven't been opened. And when you look at the DD waiver in Appendix G, it's specifically about health and safety. And so it looks very good on paper. You're supposed to have You have mandatory reporting. So the police are supposed to be investigating these. They do not. Even when people have died in host homes, we've been told, well, the victim is dead, so we can't investigate this. And I'm like, that doesn't make sense. We have APS not investigating because the person has died. We don't have the agency investigating because they have no incentive to investigate something. And then rarely do we see the community center board investigate either. So we have no system of checks and balances. And the very concerning host home providers that I have worked with have simply gone to another CCP, have gone to another agency, and have taken clients with them. And they're not on a CAPS checklist because no case was ever open. So I think it's more common than not that people are not on this. So I don't know how to capture those host home providers that are violating people's rights and putting people in danger, because the CAPS checklist is just catching, gosh, I don't even know what percentage it's catching. That would be interesting to know. But I also want to say we do need to incentivize those host home providers that do a good job. It is a very hard job. I can't imagine doing that job. And there's no incentive for them to follow all the rules and regulations if they can just go to another agency that doesn't care whether you do the documentation and take care of that person, because they'll get the same amount of money. So we have to make sure those host home providers doing a good job and those agencies doing a good job are rewarded for that work. That's all.
Go ahead, Dawn.
Hey everyone, I'm Dawn Simmons. I'm the supervisor for adult protection in Weld County. And I think that why I originally raised my hand, and then it was interesting to hear kind of a few of the last comments, was the CAPS check is only going to take you so far. People have a right to due process. They have a right to an appeal a decision, and then that decision can absolutely be overturned for, you know, several different reasons. There's a whole team at the state that does that, right? And so I think that from an APS lens, caseworkers work hard to try to find out what happened in a situation. But when we get a report, we have to make sure that there is identifying information to suggest a person is at risk. And if they are at risk, there has to be clear indicators of a mistreatment for us to assign first and foremost. So sometimes we just don't get good quality reports. We just don't have all of the information necessary to assign a case. And then if we do have enough information to assign a case, we have to have people that want to comply and talk to us. And so we can't substantiate against a professional in this capacity without having the evidence to do so. And while our evidentiary responsibility is much less than law enforcement, we still have to be able to talk to people to find out what happened. And oftentimes we can't get a full picture. So it's difficult to say that the CAPS registry would be kind of the end all be all to something like this. I really like what you said, Meg, about finding other solutions to when those things maybe don't rise to the level of an APS case being opened, or there's patterns or themes that are occurring, but because they're jumping from agency to agency, provider to provider, like you're just not capturing it. And so I think that APS or law enforcement is only part of this piece. There's a lot of things that are happening that don't always rise to that level, but it's still not okay. People still shouldn't live in those conditions. And so then what do we do in those instances?
Go ahead,
So
Christina.
I'd like to address
Oh,
a
go ahead.
comment that was made by Jody and Laura regarding when a provider is reporting that a host home provider has been terminated. That information goes to the Division of Housing to say that this IRSS, this host home setting, is no longer contracted with this PASA. I understand what you're saying with, once you provide this information, what happens with it? And although we do currently share between DOLA and HCPF this information, we're constantly in communication when these names come up. Currently, there is not a process for us to investigate, monitor, publish, or act on any of the information that we are given. So that's kind of what this project is going to give HCPF a little bit more teeth into. Now that we have this information, what legal processes can we go through to be able to share this information, act on it, but also giving the reporting parties and the host home providers, if reported, due diligence with that and their due process in this, so that, I know there was a comment made about what if you have a CASA that's just really angry that someone is leaving them and they want to blacklist them. There would be an investigative process to this and an appeal process with the committee so that all sides could be heard and a decision could be made based on the information provided. But currently that is not something that we have set up that we're really looking to implement.
Christina, you want to go ahead?
Thanks. So many years ago, there was legislation for kind of a central registry. I want to say it was 2011 that the state, there was legislation and we did not fund it as a system. We chose not to fund it. That was part of the fiscal note, was that there was that fundraising component to it. So, this has been such an ongoing issue. Maybe there's language in that legislation that will help inform some type of central registry moving forward.
I only see, sorry, as L. Johnson, but go ahead.
Yeah, there was legislation for that, but the fiscal note was too high at the time. So there was wording and there was legislation that was written that service agencies could talk with each other without there being liability to those agencies. So agencies can talk to each other about if they know the person is moving over and if that person had any substantiated abuse or rights difficulties. So that is in there, and I can't remember what the number was for it. But there is legislation out there that we can talk to each other.
Again, if we know. That's the
if you know, that's correct.
If you know. It's a problem if you don't know.
Anyone else want to share any thoughts or considerations, things they'd like to see? Whether it's, I see there's some chat in here about a registry. What at the end of this project do you want this to look like?
This is Julie. It does seem like this PASA hopping is a huge problem and a huge barrier. So is there something where HCPF could just say, like, you can't do it? Because I think even when it's quote unquote the client who's doing it, they're often being influenced by their provider. And so maybe you have a once a year open enrollment period or something where you can't just do this, but then also to have a registry. I mean, it seems like that would help. And then the other thing is we need a place to report this, because what you can report to the PASA, you can report to the case manager, often nothing happens. So I think we need a place with the state to be able to report, to say, like, this person has not gotten out of the house in 2 months, that, they're acting out because they're not doing anything. Their doctor says they're supposed to exercise, but they're sitting and watching TV all day, not by their choice, but because the provider won't take them anywhere. There's nowhere to report any of these things that works.
Julie, would you then want to see not only a place to report, but some type of investigative body to look into
Yes.
these things and follow them up?
Yes, thank you. Yes, absolutely. And that's because we don't have, right now, we don't have like, it's very unclear, like you can go to the PASA and this, and again, usually they'll try and work with the provider, but they don't really have any teeth. And then you go to the case manager and they don't have time or don't have, I don't know why, but that just doesn't seem to work. And then you have these, gigantic meetings where it's totally inappropriate. And you have this poor client sitting there with the host home provider, like standing over him, glaring at him. And then you're wondering why they don't talk. Well, of course, they're not going to talk because they're not safe. And and they're also threatened with homelessness, saying, well, we'll just stop serving you and then you're going to have nowhere to go. So like there has to be some state oversight and a place for the state to make sure that people will be safe if they speak up.
Thank you for those suggestions. That's definitely something that we want to look into, as well as the possibility for not just PASAs and case management agencies to report, but other members or other important people within a member's life. So say that a job coach is recognizing some strange behavior or unethical behavior from a host home provider. They would have also the ability to raise a flag to that.
Well, and sometimes even as an agency, like you can report things, but if a guardian doesn't want a person to move and they want them to stay with that provider, your hands are kind of tied. If you do move that person to another home, then the guardian's going to pull them. I mean, there's other considerations too. So you have to consider that as well. And then what do you do at that point? I mean, if you've made a police report, if you APS is notified, you've notified HICFA, you've notified the Division of Housing, but that person is still in a not great situation because the guardian wants them to stay there.
Go ahead, Christy.
Thanks. I just wanted to reiterate what Jabronian was just saying. Oftentimes we see this as providers, that the guardian or the person wants to maintain a relationship with a host home provider that we have concerns about. And then I also wanted to ask for some clarification about some of the comments other people were making about if only there were a place that we could report abuse, neglect, mistreatment, and exploitation. And it seems like we already have a system for that. Oftentimes, my experience as a professional has been we report things to the appropriate parties and they fail to do any follow-up. So if we suspect that a crime has been committed against a person we support, we report it, and then law enforcement or APS frequently doesn't do any type of investigation. And I think we have to take a look at those systems and where those systems are working and not working for the people that we support.
Agreed. Very good point. The last time I called the police on a situation, the responding officer told me it was very annoying. And he's really tired of all of this mandatory reporting.
I think a big piece of that is that when a report is made to law enforcement or APS, it's only recorded when it's found to be substantiated. And as Don said, it's very because you require a lot of follow-up and communication, it's hard to always substantiate incidents. So if the system where there was tracking of maybe this many reports have been made against this provider, this many came back as substantiated or unclear or unsubstantiated, so that we had a record of at least allegations being made.
The other thing, though, I put this in the chat, is there's a lot of problems that aren't full on Maine, but that don't rise to that level. It wouldn't be appropriate to call the police because someone is having the client sit in their room watching TV all day. But what we see is that happens, and then the person develops behavior problems, as would any of us if we had absolutely nothing to do in our life. And then it comes out like it's the client that's the management problem, when if the provider would do appropriate interventions and keep the person engaged, they probably would be just fine. So it's the level that we're not, no one's saying it's a crime. We're just saying that they shouldn't be getting, paid. This is not a glorified Airbnb. And I think that some of them, again, they're great ones that really engage people and keep them involved in their, with their families and communities and all of that. I'm not talking about those people. I'm talking about the ones that see this as a tax-free Airbnb, and, they can get a couple people in there and have, make quite a bit of money. And that's the problem, is when they're not doing their job. And certainly abuse is a problem too. And I agree with everything about it not being investigated, but there's a whole level of stuff that really causes harm and keeps people in crisis that is not full on abuse.
I was just going to say that I appreciate Julie's points. There are a lot of times when we're screening reports in APS, and it is very frustrating because it's just not rising to the level for us to maybe assign it. But I would say that I'm not going to speak for every county in the state. I know that counties work hard, and it can be frustrating when you've called in and you feel like it's something that definitely meets the criteria and it doesn't get assigned. But I can say in Weld County that there are often times where we will get a report or two and it may not seem like something, but had we have not had those first two reports, even if we didn't sign them, when the third report came in, if that was standalone and we didn't have the other information to consider, it probably would have made our decision differently, like on that third report. And so we are constantly looking at past reports, past allegations against alleged perpetrators. Those are all parts of a red team screening decision that we're making. I think it's also important to remember that we hear it a lot, but law enforcement and APS are looking at two completely different things. We're investigating, while the mistreatment might seem the same, our goals and the paths that we take in our investigations are different. And I think what happens oftentimes is somebody will report to law enforcement and that report will be delayed in getting to APS. APS, I think, sometimes has the capacity to share the information we get with law enforcement quicker than vice versa. But people don't have to report to APS. And I think a lot of people think that mandatory reporting requires a report to APS. We hear it all of the time, and it doesn't. And so we get a lot of reports. We're not sure if the mandatory reporter ever even called law enforcement. And I'm sure a lot of people call law enforcement and they never call APS. And so there's a lot of different, I think, complicating factors to consider as part of what somebody said around, we have to look at APS and law enforcement's role in this as well.
Thank you. L. Johnson, your hand is up, but I think it's just been up and didn't go back down, but I want to make sure. Oh, Christy, yes, please.
I wanted to add an additional comment about our existing infrastructure that we have for monitoring, and that is the state's obligation to monitor sites. So we have host home providers that we work with who have never been visited by a surveyor. And routinely what happens when program surveyors come out is they look at the same locations and the same people over and over again. And I think the state really needs to look hard at how they determine who they're looking at, how often they're coming out. I think there needs to be some accountability to ensure that the state is upholding their obligation to monitor at the frequency that they're telling the feds that they're monitoring, because it's not happening.
Anyone else have any other last comments you'd like to make? Deanna.
Just wanted to say that in my experience, I think there's a real hesitancy by case managers to contact APS or law enforcement. I've often sat in conversations where clearly we're hearing something that appears to be abuse or neglect or mistreatment. And maybe it's a lack of training by the case manager, maybe it's a lack of empowerment, but I don't believe I've ever had a situation where a case manager has called APS or law enforcement. I have often been the person to do it, so if I hadn't been in that meeting, it probably wouldn't have happened, and I don't know why that is, because they are mandatory reporters. So there's so much that happens. As advocates, we're only able to attend limited meetings. There's so much that happens that they may see or hear that they really need to be empowered and trained that this is a responsibility for the people they have on their caseload. That's just been my direct experience.
Meg, I'll hand it back to you to wrap us up.
I'm so sorry. My computer is clicking on so many different things right now. Let me get back to the slideshow. Okay. So thank you everyone for your input. We're going to take this back. I know Victoria has been keeping track of all of the comments in the chat. We do have this recording as well. Please take time to fill out that survey if you are able to, and feel free to share it with others if anybody was not able to attend. We will be posting this information, and going forward, if you have additional questions, comments, or concerns, please feel free to reach out to Victoria with your emails, or you can also always go to the HCBS questions inbox. We will keep you updated regarding future stakeholder meetings, and we will reach out to those that have indicated interest in joining small focus groups. And with that, I think that we can close out for today. I will leave this up. And if anybody needs the link to the survey again, I'd be happy to put that in the chat. Thank you again for joining us, everyone. I appreciate it.
Meg, are you able to put the link in the chat again? Thank you.